Hello, thank you for joining this Navigating Medicare, Understanding and Exploring the Options Part 5. Medicare Part D is a prescription drug coverage. Part D is offered by private insurance companies, and you must have Part A and B of Medicare to enroll. Part D plans are one-year contracts approved by the Center for Medicare and Medicaid Services, and they can change each year when the contract renews. Enrollment is voluntary. However, if you don't take Part D, you must have creditable drug coverage to avoid a late enrollment penalty, which we will talk about in a bit. Some people may already have drug coverage through other sources, such as an employer or retiree prescription drug coverage. You need to check with the employer to be sure the coverage is considered creditable in that case. Military, TRICARE, CHAMPA, veterans prescription coverage, federal employee health benefits, Wisconsin Senior Care, COBRA, and Indian Health Services. If you have creditable coverage, meaning it covers at least as well as the Medicare Part D plan, you can keep your coverage without the worry of a future Part D late enrollment penalty. Here's the information on Part D enrollment options. The initial enrollment period is a 7-month period. It begins 3 months before, the month of, and 3 months after you become eligible for Medicare. There's also an annual enrollment period, and that runs every year from October 15th through December 7th. Making changes after December 7th can happen if you are in a Medicare Advantage plan. You can return to original Medicare and enroll in a Part D plan, or change to an Advantage plan with or without drug coverage. That enrollment period is from January 1st to March 31st. Starting December 8th, you can switch to a 5-star Medicare Advantage plan at any time during the year. Some examples of special enrollment periods are relocation, involuntary loss of creditable coverage, qualifying for extra help, and you can call us for assistance with those. If your coverage is not considered creditable and you don't enroll into a Part D plan, you may be subject to a late enrollment penalty in the future when you want to get Part D coverage. The late enrollment penalty is 1% of the national average premium for each month enrollment was delayed without creditable coverage. This is recalculated and adjusted each year. You pay the penalty if you're eligible to enroll in Part D but didn't, and you didn't have other creditable coverage. There is no penalty for months with creditable coverage, and the late enrollment penalty is collected by the Part D plan as part of your monthly premium. Here is information detailing how the Part D late enrollment period is calculated. The late enrollment period is calculated as 1% of the national base Medicare Part D premium for each month you were without some form of creditable prescription drug coverage. For example, if you did not have drug coverage the first year you were eligible for Medicare, you would pay a penalty of 12% for 12 months without drug coverage of the national base premium, which would be $36.78 in the year 2025. That would come to $4.41 per month in addition to your Medicare drug plan premium. Premiums vary among plans, and they do change annually. Copays vary per plan and per pharmacy. CMS sets the standard plan guideline each year. There's an annual deductible for Part D, and for 2025, it is $590. You won't always have to pay your deductible. For Tier 1 and 2 drugs, there is no deductible. For Tier 3 and 4 drugs, you do pay your deductible. The initial coverage limit is $2,000 per calendar year. This is the maximum you will pay out of pocket for drugs in a calendar year. After the initial coverage limit is the catastrophic phase, and once you reach the catastrophic phase, you no longer pay for Part D prescription drugs for the rest of the calendar year. Thank you all for joining us today. Please continue following along in Section 6.